Hi, welcome to Happy Tales. I'm Cheryl Rosenthal, Communications and Education Coordinator here at the Oshkosh Area Humane Society.
And I'm Joni Geiger, Executive Director.
And today our show is going to be with our guest, Tawana, who is our medical coordinator. And the feature of our program is little Hazel here. And Tawana is not only our medical coordinator, but she is also Hazel's foster mom. And Hazel is a little puppy that was found in a plastic bag behind a dumpster. And she was found and she was brought to the Humane Society.
Right.
And so it is our Cuddles Fund that is helping to help us care for her. And we'll be talking more about her needs. But I think first, Joni, can you tell us what about the Cuddles Fund and how it works?
Sure. The Cuddles Fund is actually was the result of a small dog named Cuddles that was thrown over the fence back in 2000, in August of 2000. It was a very sad situation where a gentleman owned the dog, became very angry and upset because the dog peed in the house, and he beat the dog, and then after he did that, he drove it over the shelter and threw it over the fence. And unfortunately, it was a very sad situation for Cuddles, but because of the media attention and people hearing her story, they really rallied around it.
Right.
I mean, it was all over national news. It was a wonderful opportunity to share the story and also share the story of so many animals.
And
being
I believe
in this
Cuddles
predicament.
ended up with a broken pelvis.
Yes, that is correct.
So probably a result of either the beating or being thrown over the fence. And she did fully recover.
She did.
And because of that outpouring, we were able to do that.
Right. And because what had happened is we did receive a tremendous amount of monetary donations, and so what we decided to do, because we couldn't use it all for Cuddles, is to put it aside for animals that needed that type of help. So we consider it more of a catastrophic fund. It's totally separate from our medical fund.
Okay.
But this is for specific animals that need some extra medical help.
Okay. So kind of extreme cases, like if we have a dog that comes in with extreme heartworm,
Right.
That would help treat that
Right.
dog. Animals with a broken leg, things like that.
And honestly, because the budget is so tight, Cheryl, as you well know, there really isn't the money for that in our regular budget. So having this separate fund has really saved hundreds of animals that we normally couldn't help.
So our regular medical fund, that covers vaccinations, heartworm testing, all the things that the medical things that we do
on a regular basis every day. Yep.
That medical fund is about $80,000 a year, correct?
And that is totally separate from Cuddles.
Separate from the Cuddles Fund. Right. So over and above our medical fund, we have the Cuddles Fund so that we can help animals that come to us with extreme medical needs and treat them.
So hopefully that helps people to
understand
the difference and why it's there.
Well, I know it helped me understand the difference. So Tawana, this has been a great undertaking. I mean, how old is Hazel? How old was she? Was it thought that she was when she came to us, and what exactly is happening with her?
Yeah, well, I'm just gonna pick her up because she's just being a squirmy wormy right now. Hazel, we guess, was about 2 weeks or so when she initially came into us, and that was just based on initial exam by a couple of veterinarians.
Okay.
Based on her teeth, or lack of teeth, I should say. She only had a couple in that mouth. With further diagnostics and a little bit more of a deeper physical exam by some of our board-certified veterinarians, they felt she was a little bit older.
Okay.
So she's about 4 to 5 weeks of age right now.
Okay.
She is.
And you mentioned earlier that she's getting teeth.
She is getting teeth. She is a chewing machine, hence these little toys here.
I heard her growling before.
Yeah, she likes to shake at her toys, and she's a little upset when they don't talk back to her. So I just like to have lots of things available so we don't teach her bad habits so she doesn't have litter mates. She needs to know that teeth hurt when they bite.
Right.
And
so that is a disadvantage, not being with other puppies, not being able to have another puppy teach her how to inhibit her bite. So I see that she has some kind of little braces on. Explain to our viewers what.
Hazel was diagnosed with a syndrome called swimmer puppy syndrome, and that's something she was born with. This is a congenital abnormality, and basically it means her rear legs, and in this case sometimes it happens with the front legs, the muscles haven't developed properly, so she's what we call frog legs, so she can't walk properly.
Okay.
So what I've done, and through the referral center, is basically hobble her legs into the position that they should be, so that she can so her legs can basically be retrained.
Okay.
So we keep her in these hobbles for about 24 hours a day. I change them probably daily because she's a puppy and she gets a little messy, but it's meant to retrain those legs so that when she sits, hopefully what the idea behind this is that her body will regain use of some of that muscle and she'll be able to reuse those legs. Because right now she can feel them, she doesn't have a need to use them because she's never used them before.
Okay, so it's just like us. We have to
Yeah.
learn how to walk.
She
and
has
you
to
don't
learn
have
how to
those
walk.
muscles.
You bet.
So what are some, are there exercises that you do
Yeah.
also with her?
You bet.
Like physical therapy,
Yes.
I guess is where
Yep.
I'm going.
We do physical therapy probably 4 or 5 times a day, a little bit more on the weekends just because it's nicer outside. She does like to be outside. With her and all puppies with swimmer puppy syndrome, it's a surface issue. So if it's a slippery floor, she's not going to have traction, so she
of
gets
course.
frustrated. So I usually use a carpet. At home I have a yoga mat for her. And
Okay.
we do massage just to kind of stimulate some muscle response. And she's hobbled now, so I won't be able to do it. But when I take her out of her hobbles, I do range of motion. So I really
Okay.
just try to stretch those legs, getting them in that position. Because like you said earlier, since she doesn't know how to use them, those muscles basically don't exist. So if we don't continue to exercise them and encourage them to grow, they're not going to be useless. They'll be useless to her.
She's
so we do that
pretty
several
good at
times.
pulling herself by her
She's
front
very good
legs,
at that.
so-
She was doing that even before we hobbled her, and it's not that she can't move now. She can't move as fast or as freely, so she really has to think about it because her center of balance has changed a little bit. So she kind of does a little bit of a bunny hop, but she can move if she wants to move.
Right. Well, she certainly seems to be a little determined little girl.
She is exactly
and,
that.
So when she's not hobbled, in other words, she's pulling herself.
She's pulling
by
herself with her front legs. Yeah.
And she does not use those back
She
legs.
doesn't use them. She drags them.
Have you seen any kind of improvement, or is it too soon?
I
or-
have.
Okay.
When we first hobbled her, she had no clue. She face planted, she tipped over, she really couldn't get that center of balance. She knows where her center of balance is now, and she just kind of pulls that puppy, shows me her brown eyes, pick me up.
Yeah.
She got the wrong foster person for that because I'm going to definitely be a tough personal trainer here. But she does get along. If she's determined enough, if she sees one of my cats at home and if
Sure.
she's interested, she
Sure.
will pull herself over there and scoot.
Yeah. And how do you
moves.
feed her?
She does eat canned puppy food now. I was putting some formula in there, but like any other picky baby, she discovered that and decided that wasn't acceptable to her anymore. So she does get canned food, and I usually use it on a plate. And I actually incorporate that in her physical therapy because when she's hungry, she wants to move. And we get her to do some range of motion exercises, and I really get her walking because she is food motivated.
So the
she's
food
eating,
is the big
Yes.
motivator for her.
Yes.
Okay. What kind of personality does she have?
She is a pistol. She is a pistol. She sets her own schedule, and of course, like any good, foster parent and guardian, she's trained me well.
Yeah.
We're up probably about every 4 hours through the night
Wow.
because she is hungry. She maybe eats an ounce at a time, and then she wants to play. So this morning she knew we were going to be on TV, and she let me sleep in until 4 a.m. instead of our usual 3 a.m. walk-up call. And then she's up and she wants to play.
Yeah.
She wants to play. She wants to do things. She's
Yeah.
got better things to do than to
Yeah.
sleep.
Is she vocal?
She can be when she's hungry.
Yeah.
And when she wants something. So
And
that's
the reason
where,
I asked that is because I heard her screeching
Yes.
when she was hungry, and I'm
startles
talking
you.
screeching. I
It
mean,
startles
was
you. It sounds like a banshee.
It does.
I refer to her little banshee scream.
Yeah,
so
it kinda scares you.
I usually catch her schedule as far as that goes. But if she wants attention, she will absolutely let her audience know,
Right. Sure.
pick me up. So
Sure.
she's training us, and that's where we need to kind of step in and make sure we have a little bit of control.
So what kind of a puppy do we think she is?
From what we understand, a mom might have been a Boston Terrier, so we're
Okay.
thinking a small breed.
Okay.
We're not really sure what that is. She's just over 2 pounds. So my guess is she's probably going to be a smaller breed dog, and I feel that probably is to her advantage because of the condition.
Right.
I think we'd be looking at a few more challenges if she were a larger breed dog. I think she'd be able to get all those hobbles a little bit easier, but we think she's going to be a small breed terrier.
We must have wore her out already. She's
Must be.
Now I
So
did
speedy.
notice that she has a little bit of a skin condition.
Yes.
Can we talk about that?
Yeah, since she came into us so young, and that's part of the reason why we wanted her to be with mom in a perfect world, she just doesn't have the immunity that she should have. So she's already had her first round of vaccinations, but we did have to wait a little bit for her to grow up for that. So she does have a staph infection that's kind of going down her back here. Staph is a bacteria that's on all of us, including people, and when you don't have an immune system, that's when it kind of takes over.
Right.
And that's basically where that kind of came from. So she is now on a topical antibiotic, so it does still look a little funky, but it is much better.
It looks tremendously better.
Yep, it looks
compared to
much
what she
better.
was.
And she's not fazed by it. She
Right.
doesn't know any different.
Right.
So it's
Now-
not like it itches or or anything.
Nope.
It's just
Nope,
there.
nope, and that's part of our massage. I'm always just kind of feeling around there just to make sure we don't have anything that I need
Right,
to address.
right.
And it doesn't bother her. It doesn't bother her at all.
Now, it looks as though there's some like skin attached to it. Is that something that's going to have to be removed?
That's what one of her doctors at the referral center is considering as part of the treatment because she's so young. If we can get the skin taken care of, we can move on to the next phase of therapy, which includes swimming. But we don't want to do that with a skin infection right now. So that may be in her near future.
So when you talk about water therapy, what exactly are you?
She's basically going to be swimming as part of her therapy. That's a natural range of motion. So when she's in the water and they'll have a little vest and there's always someone in there with her, her legs will naturally move the way that they need to.
Yeah.
And that will help build up muscle. And they do that quite a bit at the referral center with any dogs with major orthopedic surgeries or muscle injuries.
Sure.
It's a good way for them to recover because they're basically essentially floating in water. It takes all that weight off.
Right.
And it's a natural motion. So to her, it's probably just going to be another game.
Now, as far as like, obviously being smaller and younger, because she has this challenge, I would assume that that's better for her. But obviously, the sooner she starts the swimming is better for her.
Yep. Because I think the sooner we're going to see some response. I am seeing some response with the hobbling, but everything that they've done some research on, that's her best efforts. We're going to we should hopefully see a lot of improvement when we see that.
Right. How long is that therapy? Is that months?
It can be months. I've read some things where it's been a couple of weeks and dogs are responding. Sometimes it's a little bit longer. Each dog can be a little bit individual. And usually a swim therapy session is 10 to 15 minutes. They don't want to exhaust the dog.
Sure.
And as they get older, as they become better at it, because they don't want to stress them out or frustrate them, those sessions can go longer and they can be multiple times.
Cool.
So that's going to be in her hopeful near future. That should be funny. Hazel in a swimsuit.
So what is your typical routine for her? I mean, obviously this is a 24/7.
This is.
And it's, the fact is that, and I do want to share, I think that what you're doing is admirable, and I think it takes a special individual to do this.
Around the clock.
It is.
Yeah.
It is
I mean,
around
it's
the
a
clock.
tremendous commitment.
It
it's
is.
really a tremendous commitment.
It is.
And I know how hard you work here, and then to do this and take this on is pretty tremendous.
Yeah.
But that being said, what are we talking about a typical day for Hazel?
Yeah, well, I'm definitely lucky enough that she gets to come to work with me because we've got some really awesome volunteers during the day that'll help me with her physical therapy. Because I definitely do get busy here. So between helping her with therapy, we're also socializing her to a lot of different people, which is good. So she can't pull all of her dirty little tricks with just me. And I give everyone a heads up because she definitely has that tenacious mentality if I can get away with it. And I think that's very typical with all puppies, just kind of testing those boundaries. So I think that's good socialization.
Yeah.
So when we're up, this morning I was up at 4, so we had a little snack, and then we did our physical therapy. Since I was up and she didn't really want to go back to sleep, I have a sling, so she just sits in her sling, and then we do my own little animal chores, and we go for a walk around the block, and then usually I'm doing a little bit more physical therapy, so it's just stretching those joints. So it doesn't see, I don't want her to be afraid of hands because she certainly has to be touched quite a bit.
Sure.
When I'm not there to supervise her, she is crated for her safety so she doesn't wander off.
Sure.
Because she's fast. When she wants to move, she can go. And then I know where she is. She's still not house trained yet. So that's always,
Right.
it's always a phase.
She's so tiny. She's even in a small crate.
She's got plenty of room in there. And then that way too, I know she's at least quiet. So I'm kind of forcing some type of rest. I know she doesn't sleep. She won't take a nap today until this afternoon because that's who she is. And then just every 4 to 5 hours, I'm offering her a snack. And every time I offer her a snack, I'm doing some range of motion things. But when she's out, she sleeps quite soundly. She's a snorer now. Not as loud as my bulldog at home, but it is something. Because I'm like, what is that noise? And she snores now.
So, is it possible to put her with a litter of puppies, or?
I certainly think that would be great for her in the future. Hopefully, the near future, once we get the skin under control, because puppies are puppies and they do a lot of things with their mouths.
Right.
I wouldn't want them to bite at her skin anymore.
Okay.
But I think that would be great for her socialization to have puppy dates because she really is missing out on that key time.
I totally agree.
We don't want her to be a little diva as a young adult puppy. So I think that would be something great in the near future to really get her that interaction that she's missing out on from not having litter mates.
Right.
She is playing with kittens, though, isn't she?
She does like kittens. She likes my cats.
Yeah.
She likes my cats. She's got one cat in particular that she likes, and he'll sleep in the crate with her if I let him. He takes up a lot of the crate, and then he becomes a chew toy. So he tolerates that quite well, but she's she's just a curious little puppy. She's a curious little puppy, and so we're just trying to expose her to as many things as safely as we can.
So I take that personality bears well for her.
Yes.
Particularly under her condition. Because
Yes.
if she was like less...
I think she wasn't as
a-
tolerant, or she
Right.
just, you can see it in her eyes. She's a determined puppy. She
Yeah.
doesn't know any difference, and she's
certainly-
got a lot of pep in there, and I think that's really going to get her through this.
So she's got a lot of spirit.
She's not a shrinking violet.
She
Oh,
definitely
I
is
can't
not.
touch
She's
that.
not. She's not a
Oh.
girly girl, as I like to say. She's kind of a rough and tumble girl, and that could be exposure to my Frenchie or even me myself. But she's really tenacious, and I think that's what's really going to get her through this.
Right.
And I think that's also going to help the people that meet her to understand she's not just this teeny tiny little puppy. She is, but she doesn't know any different.
Yeah.
And this is just a little roadblock for her.
Well, sure. And people, very often when they see these types of situations, their first instinct is, oh, you poor thing.
I feel
and
so
they
bad
feel
for
so
you. I
sorry
feel so bad for you.
them. And,
Yep.
and really what she needs is confidence
Yeah.
building
Yep.
and really, like you said, a
Yep.
strong leader.
Yep.
And the
Don't
fact that
cater
you're
to
doing
her.
this.
Working out with Tawana.
I
Working
know.
out with Joanna,
She's
yeah.
going to end up with more muscles than me, and then I'm going to have a problem with that. So she's a great little girl, though.
We also should mention, I mean, the likelihood is like when people see this is that they would be interested in adopting her when she becomes available. But I think that it's important to just share that the particular individual that did find her has expressed an interest in adopting her, and we certainly would give that consideration.
Yep.
So, okay.
So-
All right.
Yep.
Very good.
Yep, unfortunately, only one person can adopt Hazel. But,
Yeah.
every animal, Joni, here at our shelter, she has a really dramatic story.
She does.
But every animal that comes to us has a story. They've been brought in by their owners, or they've been abandoned outside. Something has happened to them that they're here.
Right.
I just feel so strongly that if you can adopt Hazel, in Hazel's honor, you can adopt a different shelter pet.
Right.
Save a life.
Right.
And that's what we do here.
Right.
We save lives.
Right.
And we can't do it without the community's help. And so, if you're thinking about adding an animal or pet to your home, and you think, oh, I'd really love to have Hazel, maybe we can find you your own little Hazel.
Sure, sure.
To
I think
to
that's-
adopt and take home.
I think that's really important, and I think you make a valid point here, Cheryl, when you talk about currently, we have probably close to 325, 350 in animal numbers, and every one of those animals that come through our shelter has a story. Again, not as
That's
dramatic
extreme.
as Hazel, but certainly a story, and they all need help, and they all need a home, and they deserve a home.
Right. Well, they
And-
all have the same thing in common.
Right.
They don't have anybody but us to take care of
Right.
them. And as much as we would like to take care of them all forever, we can't. And we need
Sure.
we need the community support. And it's not like we're going out and or we're manufacturing these animals. They're
Right.
coming to us in
Right.
from the community.
Right.
So I guess part of me sometimes feels too, when you adopt a shelter pet, maybe you have a neighbor or a friend who, for whatever reason, had to give up a pet, or maybe
Sure.
you had a friend that passed away and their pet ended up at the shelter. And when you adopt an animal, you're not only helping that animal, but you can think of it as helping other people in
Sure.
the community,
Sure.
giving their pet a chance.
Right,
So it's kind
absolutely.
of a two-way street there.
And we also want to mention the Cuddles Fund, because obviously if people would like to give to the Cuddles Fund, we would very much appreciate that, or even to our medical fund. So
Right.
I do want to talk to Tawana a little bit, because we've talked about Hazel, but I think let's talk a little bit about that other side of it, which is the medical fund and what we do here medically for animals. So you're the coordinator.
Yep.
You have very specifics that when an animal comes in, what's being done. So why don't you share a little bit about that, about
Yeah.
what the shelter does?
Yeah, so with every animal that comes in, cat, dog, rabbit, small mammals, sometimes even wildlife, we're doing a brief assessment. So we want to look at the physicals. Is there anything gapingly wrong? Is there an open injury that we need to get to a vet sooner rather than later? We're also kind of watching for disease control, because like you said, there's 300 plus animals in our care. We don't need a flea outbreak. We want to try to get some of those situations under control
Sure.
right from the get-go.
Right.
So right as they come in, they're going to be isolated because we want to make sure all of those obvious ones are taken care of. We also are vaccinating everyone for their protection, as well as all the other animals in the building. And that was one of the reasons why we kept her segregated, is
Right.
because she was too young.
Right.
She was at risk for all those common viruses that we can protect against.
Right.
She would have been that much more vulnerable. So that
And
was the
her
reason why she
immune
went.
system,
And
you
her
said,
immune
was
system was
compromised
clearly
'cause she
not
was
the best.
not
and she
getting
was so
anything from
little.
mom.
She was
Yeah.
so little. So we're going to vaccinate upon arrival. We're going to deworm. We're going to check for fleas and ticks. Try to just make sure their basic medical needs are met for their safety as well as the safety of other animals. And then if there is something that we need to address, so there's an eye injury, there's an infected ear, we can treat those accordingly to prevent some infection from spreading, but to provide some relief and comfort because they can be pretty uncomfortable for those
Yeah,
animals.
yeah.
And then if we need to, we get them to the veterinarian right away if it's something out of our control. So we're talking a broken bone, something that just doesn't look right, the animal's not responding the way we typically would see them.
Right.
And that's with every single animal that comes in, and that's going to average 20 or so minutes per animal
Yeah.
if the animal cooperates.
Yeah.
They don't always want to be here. They don't always want to see me coming.
Yeah.
So sometimes it's just a matter of just kind of going on their terms. But we do all of that, and that's what the medical support,
So,
we need that.
so you guys are going from head to tail.
Yes.
And
Yep.
you're
And we're
looking at eyes, you're
for-
looking at teeth, you're looking at
at
mouth.
ears, we're checking feet. It's amazing some of the dogs that walk in that we think are older. They're not older, they just need about a half inch taken off of their nails. They're walking,
Right.
it affects their walk,
Sure.
and that's certainly going to affect the way that they stay in the kennels.
Sure.
And we want to try to make sure they're as comfortable as we can make them.
Right.
So we're doing all of those basics on top of the vaccinations, and then kind of triaging them. Who needs to see a vet right away? Is this animal going to be ready for surgery? We're also looking at loss reports, and we're posting them on our Facebook page to see if we can find their owners, as well as checking microchips.
Right.
Because if we can find that owner, that's going to be best for everyone.
Sure.
But if not, in the meantime, while they're in our care, we want to make sure they're as comfortable as we can make them.
So what I'm hearing from you, Tawana, is that every single animal that comes in here needs medical care.
Yes.
Every single animal.
Yep. Absolutely.
I mean, even if they're healthy, they're vaccinated.
We're
they're-
still vaccinating
yeah,
them. Even
right.
if they happen to be current on a vaccination, they don't speak our language, unfortunately, so we don't know that. Very
Right.
few of them come in with their vet records attached to them. So for their safety, and again, for
Never
the
seen
safety
it,
of all
yeah.
the animals in the building,
Yeah.
we do vaccinate for some of those preventative diseases.
Oh, and what are the vaccinations?
So we're going
that
to give
you
them a
guys use?
distemper vaccination if they're a cat or dog. Our dog vaccinations do include an extra protection in there. The dogs are given Bordetella, which is to help protect against kennel cough.
Right.
In a situation like a kennel, which is basically what our holding facility is, that's the last thing we need is kennel cough going
Is an
through,
outbreak,
and
yeah.
it's an outbreak, and it's pretty contagious. We're also deworming them. They're not going to tell us that they have parasites. A perfectly healthy animal can still have parasites.
And
We
if
wanna
you
make sure
and if
that.
you do those things,
Yep.
there's no harm done.
There's no harm. There's
Right.
no harm, but a lot of times what's found, the animals usually aren't current, so now they're current. So when they go home, they can bring that information to the veterinarian and they're current for a year, so at least have a little bit more protection against them. And again, we're looking for fleas, we're looking for ticks. We're trying to get all of those basics under control before we put them into our regular holding facility.
And I think every animal must be different because some are going to be very comfortable, some
Yes.
are going to be scared, some
Yes.
are, and some animals when they're scared, they can either be very shy and
Yep.
reserved, other ones can become a little
Yep,
bit more
they can be a little bit
assertive,
more
like,
anxious.
"Whoa,"
Yeah, yeah. So it's an individual, so it certainly is custom. So I mean, if you're talking on average of 10 to 12 animals coming in each day, 20 minutes for a comfortable one. Sometimes it takes a couple people. Sometimes I just leave the room because they associate me with all the pokes, and that's fine. And that's why we have a number of people that are able to do that. But it is. They're not always excited to
Right.
be here, and
Right.
sometimes it's a scary place for
some
if you don't know
yeah.
it.
And so some of them it takes longer. Some of them you can kind of go
Yep.
right through and get all of that medical done. So,
But
so
Now, you also we do surgery in the building, and let's
do.
talk a little bit about that and what that entails and how
Yeah.
I know it's 1 day a week, and
Yep.
and we have a veterinarian or veterinarians that come in and
Yeah, we have surgery 1 day a week here at the shelter, and in order to basically be eligible for surgery, if it's a stray animal, we need to make sure that stray period is up so that
Right.
we don't have an owner. We become the owner and we can make those medical decisions for them.
Mm-hmm.
Now that we're in kind of the thick of the season where animals are literally coming in as fast as we can handle them,
Yeah.
we're doing that many surgeries. Yesterday we did about 48 surgeries in about 4.5 hours.
That's amazing.
Wow.
And it was everything
Wow.
from cat space to cat neuters to repair, taking a couple teeth out, dog space, dog neuters, heartworm testing, microchip testing, doing all those things in a very, very brief period of time. So it takes a lot of coordination.
These are
Yep.
shelter
These
animals.
are shelter animals that are now going to be available and ready for adoption now that they're cleared medically.
So I think, you know, the
Yeah.
point being too is just that people need to understand that this medical fund that we, you know, draw from is extraordinarily important. These animals need to be addressed upon arrival. They, you know, and during their 7-day straight hold or hold
sometimes
while
longer.
if they're being surrendered, and then of course if they're not spayed or neutered, we have to do that. And so. When people adopt from us in particular, you know, obviously all these things are in place ahead of time, which is a tremendous gift actually, because our adoption fees are very, very reasonable, and I think that in the process people are also helping to save a life, because every time you adopt from a shelter, obviously you make room for one more. Which is extraordinarily important for us. So we just can't stress enough how important these funds are, as far as like our Cuddles Fund, so that we can help animals, you know, like Hazel here, and hundreds of others that have gone before her, and that will come after her.
Right. You know, we handle between 23 and 2,500 animals a year.
Right,
So,
exactly.
That money doesn't
Yeah.
always go that far. So,
And it doesn't grow on trees.
so well, I'm hoping that,
looked.
you know, our viewers have enjoyed meeting Hazel and Tawana, and we thank you for your time.
Thank you for having us.
And if you'd like to make a donation to the Cuddles Fund, please visit our website. It's oahs.org. If you have any questions regarding our procedures here or the medical fund, how things are used, you can give us a call at 920-424-2128. And so I think that just about wraps up.
Yep.
I mean, we could talk about this forever. Again, we just also want to thank anyone who has donated either to our medical fund or to the Cuddles Fund. Thank you so much for making this possible. We are willing to do the work here as long as we have the community support, and that is shown by your gifts, and it's greatly, greatly appreciated.
Absolutely.
So until next time,
Happy tales to you.